Everyone, and welcome to the second Healthcare Industry Roundtable. If you recall, we launched Getting Southern Maryland Back to Work early in the COVID period last year. That sounds funny, but in 2020. And the regional partners that are behind this are the Tri-County Council for Southern Maryland, the Workforce Division. I'm the Director of Regional Workforce and Business Development, and the College of Southern Maryland, Ellen Flowers Fields, with the Continuing Education Department. So we had our first industry town hall when was that, June, July? In July, heard from you about your needs. There was an overwhelming desire by the participants in that meeting to meet quarterly, again, to share best practices, talk about your workforce needs, give us some guidance as your workforce system and what we can do to help you meet those workforce needs, and just to share as an industry. So this is our second industry roundtable. And we would like to talk a little bit at the beginning here about what has transpired since we met in July and since we talked again in September. So I believe Kelly Winters is going to kick that off from the College of Southern Maryland.
Good morning, everyone. I believe we're going to talk about direct service professionals and training for those. Isn't that one of the major topics we identified originally?
Yes, there was a very strong voice from the disabilities community that they were in a workforce crisis. That came out in the June meeting and again in the September meeting. So we wanted to share with you the work that Kelly and the College of Southern Maryland have done since then to try and address that. We did try to reconvene the DDA partners to have this discussion, and unfortunately there wasn't much response. I think we only heard from one. But this is an opportunity for you to see what's available, what's being done for this community.
So what I have up here is just, don't worry, it's not death by PowerPoint at 8:30 this morning. It's just a few slides. After we met, I got with Ellen and I decided to take a look, do a little bit of research about training. And, you know, one of the biggest complaints we heard from the DDA folks, or the biggest barriers, was getting their people trained and then retaining them. So I looked for a few things, put together a proposal. I'm not gonna read the slides to you. Just going to, let's see if I can get it to go. Like being hang on a minute. Let me unshare. It does not like being on a screen shared. I don't know why.
And if you wouldn't mind, if you're not speaking, please put your line on mute.
Oh. All right. Now let's see. Ruthie, it is, although I tested this in Zoom yesterday, it is Teams is telling me that the version of PowerPoint is not compatible. Let's try it one more time. All right. Let's see if it'll let me do it manually. There we go. So I used a couple resources when I was putting together, trying to figure out what the training would look like, what other people are doing for training, why getting these individuals trained is such a barrier for DDA communities. Of course, first I looked at the COMAR regulations here in Maryland, and then I actually discovered, still kicking me out. Then I actually discovered.
Kelly, I pulled it up on my screen. Can everyone see these slides there?
Great, Ellen.
Just want to make sure people can see it. Ruthie, can you see it?
I see the title slide.
Okay, yeah, that's what I put up there.
Okay, let me
Kelly, you can just tell me when to advance.
Okay, let me see if I can get. I don't see it. I don't see it, Ellen.
You can't see it.
Nope.
Does anyone else see the presentation? I'm so sorry, this isn't working this morning. Okay, yeah, I see from what they're saying, yes, they can
I
see
see
the
it.
slides. Yeah,
I see it.
thank you, everyone. Okay, just tell me when to advance, Kelly.
Okay. Let me just bring up, I don't see it on my screen, so
Okay.
I'll just bring up my copy. If we're on slide number 2, where I'm talking about resources,
Okay.
there were a couple resources that I used for this. The first, of course, was the COMAR regulations for the state of Maryland. That's actually the link there. And Ruthie, you can share this presentation with anybody that's on the call or anybody that would like it. And I can provide documents for some of the other resources that I used. And then I looked at the Maryland Department of Health. The Developmental Disabilities Administration actually has a little manual out that was adopted in 2017 that discusses the training opportunities and the training requirements. Ellen, if you'll move forward one slide.
Mm-hmm.
From that Maryland Department of Disabilities Administration, these were the minimum requirements that anyone that works for a DDA agency that provides direct care, including their volunteers, would need. It's a pretty hefty list. And if you go through this list and you think about each one of these requirements, it becomes quite evident why this community is having such a struggle in getting and staffing. So moving on, what I decided to do was take this list, the requirements, which really doesn't tell us exactly what training is required, but what the minimum requirements are. And I decided to look at 2 other jurisdictions. Ellen, if you move forward the slide one time.
I did.
I went to the District of Columbia. Their training is put out in 3 phases, kind of an orientation overview of the topics listed there on the slides, about what one would expect. Phase 2 was, they spent their phase 2 training with an experienced direct service professional, where they did some applications of what they used in phase 1. Phase 3 was all their competency for the topics in phase 1. And then they had a phase 4, which was kind of more advanced. They did not, DC's reference did not provide the actual hours on each topic or the total number of hours that was required, just that they needed to move through these different phases of training before they could be alone with a client. So I also looked at Tennessee. And Tennessee organized theirs a little different, external certifications. They use an online vendor for some modules. And then they also have to deliver some modules face-to-face. So external first aid CPR, online modules, which I thought was pretty reasonable. And then the in-person modules constituted the biggest piece of their training. Now, in Tennessee, they actually have a requirement, and the requirement is 43 to 44 hours of training. And then once the training's completed, they do an 18 hours of shadow time with an experienced staff member. That I found, I tried to push that research a little further and see if in Tennessee, maybe this was an apprenticeship registered program. Just thinking because of the required shadow time. And I really couldn't find anything that would lead me to believe one way or the other, but I did find it rather interesting that they actually spelled out the shadow time. Whereas if you compare that to DC, it just says they're here with. Ellen, if you want to move one step forward. So using all that information, I put together a little proposed training outline. So these are the COMAR titles from Maryland, and then what the college currently has in our inventory, if you will, that could meet those COMAR requirements. So you see that I would need some industry input there under community integration and inclusion, and then individual directed outcome oriented care planning, or typically the care planning done in the community. So I would need some industry input there to put those sort of things together. Everything else kind of falls into the one or two courses that the college offers currently. So Ellen, if you move forward one more slide, these are some of the additional topics that I pulled from my research that were not specifically broken out in the COMAR regulations. But I think that under the conditions we're under now, you know, hand washing and PPE would certainly be a no-brainer. Body mechanics, because they are moving folks around, personal qualities, professional skills, critical thinking, teamwork and leadership, and of course HIPAA and patient rights, which probably should be expanded to choices and decision making in the DDA community. So those were the topics that, while the state of Maryland didn't specify them in those words, if you go back and read the COMAR regulations, because I know everybody just wants to do that, you'll see that there's reference to the knowledge of these things. So that was, Ellen, if you move forward, that was kind of what I put together. At this point, you know, in order for the college to move forward and kind of develop or build out this kind of training to help them, we'd actually need some of these providers to come sit at the table with us. That's kind of where we are now. And I'd be happy to answer any questions. Again, I can share. Ruthie and Ellen have this presentation. I can share it. And if you would like the actual documents that I used, you can shoot me an email and I can share them as well.
Wonderful. Thank you, Kelly. There's been some communication in the chat box. Clarissa Mitchell mentioned that she has a training list that their company uses to audit staff training and can share it. So Clarissa, if you'll send that to me, I put my email address in the chat box and I'll be happy to distribute it. Also, Kelly, if you'll send me your slides and any other information that you have available, I'll distribute that following this meeting as well. Do we have any questions regarding the DDA community, the training needed, and their workforce crisis? Or comments?
Ruthie, this is Ellen. I have a comment.
Okay.
So I just want to emphasize Kelly's point about the research that we've done in order to, you know, deploy the training that would meet the minimum requirements of COMAR. That industry input is what we're needing. And we need to hear from the industry. That very good question that just came up about whether it be online or in person. We need to hear from the industry what would be suitable. You know, there may be component parts that could be online, but certainly some hands-on portions. I think we have that flexibility. What we don't want to do is create a training that no one wants to send a workforce to. What we did hear from the DDA community was that, one, it was hard to recruit this population with they very often recruited individuals with no skills or experience or very minimal in the healthcare field, and that they had to train them on the job, and that they had a very difficult time retaining these people because of the high level of skills. When you look at that skill requirement list, there's a high level of skills needed, but the pay rates are relatively low, and so they lose people who are making $1 here more, et cetera. And so, our hope is not only to put together a training that could help create a pipeline of qualified individuals that could walk through the door, that could help to minimize the amount of training that these providers have to do on site. Hopefully, they can develop revenue models that could defer monies they're using to train people to pay people more and can help with retention. But again, until we can get industry around the table to further that conversation, we're sort of stuck. But we wanted to just present that and say, we're prepared to assist if that assistance is still desired. So thank you again, Kelly, for that.
You're welcome, Ellen. Again, if anybody, I'm going to put my email in the chat box. If anybody wants to have a individual conversation, I'd be more than happy to sit down and talk to you, look at what you have, discuss other options, or if a group of you would like to, that would be fine as well.
Hi, this is Mary Jane Self. I just wanted to mention that it seems like when I look through that list, quite a few of those competencies are taught at the Forest Center in our allied health class. So it might be something that we want to bring the Forest Center in as well. I know they have a lot of links to College of Southern Maryland and classes and that kind of thing, but quite a few of those points of interest of what they need for training is taught already at the Tech Center.
And that's a really good point, because a lot of those topics are very broad and are found in many different types of healthcare training, from CNA to medical assisting to introduction to the health field, healthcare industry itself. So I believe the resources are out there. It would just be kind of disassembling some of these longer courses and pulling the pieces together. But you're absolutely right. And I imagine there's many versions of them.
But that's an excellent point. I'm sorry, I don't know who said that. When you really talk about pipeline, there may be an opportunity to work with the high school allied health training programs to help create some experience opportunities for their students in the industry. That could be very compelling. That's a great point.
I'm looking in the chat box again.
Yeah.
Let's see. The other focus for employees in the industry would be if they have this certification from the college, they could go to other agencies and not have to be retrained. Good point.
Correct.
And Clarissa Mitchell says, it seems my mic is out. In general, we are required to provide a minimum of 70 hours of training. This number doesn't include specialized and individualized training. The bigger issue is cost to maintain the training, and I lost the cost to maintain the training that requires renewals. And Elizabeth Foster says, I agree with Donna. We would need a training that would be recognized throughout the industry. Online training is a good option as well. And Carrie Aiken says, Calvert is starting the Apprenticeship Maryland program. There could be an opportunity there with industry partners. Indeed. Carrie, you want to tell us more about that?
Good morning, everyone.
Good morning.
Happy New Year. So Apprenticeship Maryland, I think St. Mary's County also has it. I'm not sure which fields they're working in, but so we're just starting, and basically what it would require would be an industry partner, so someone in the field that would be willing to sponsor a registered youth apprentice. And the very, very short version of how that works is that we work together to provide the student appropriate related instruction. So it could be some of the online things that you guys are talking about, could be things at CSM, And then the industry partner agrees to have the student as a paid apprentice for 450 hours. And so it can be worked out as such that, you know, because I know there's prerequisite things based on those COMAR requirements, it looks like. So a student could be required to complete those things before they start at the actual apprenticeship. So if anybody thinks they might be interested in that, I'll put my email in the chat and you can feel free to reach out.
Karen, thanks for sharing that. We have I have a meeting. I hope you're going to be able to be there with the CTE directors coming up, I think next week. We're following up on some things. That would be a great conversation for the three of us to have.
Okay, yeah, I'll double check. Double check, make sure it's on my calendar.
Sure.
Just as a side note, St. Mary's County is involved with the youth apprenticeship program already. So our allied health class and many of the other classes at the tech center can get involved with that right away.
Outstanding.
I think one of the biggest barriers with the school systems is the requirement for this particular job source coming out of COMAR is 18 years of age. So it would be a good opportunity to for students leaving high school. I'm not sure in this day and time how many seniors we have that are already 18, but they have to be at least 18 years of age.
This is Bonnie Kelly. I'm with St. Mary's County Forest Center. One of the things we can look into also is through AMP, the Apprenticeship Maryland program, we do work with the Department of Labor, and they may be able to help us with some, maybe, you know, helping us with getting the age, I don't know, I want to say waived, maybe if we get the students in apprenticeships at a younger age so that when they turn 18, they can move right into the workforce. That may be something we can look at with Department of Labor.
Great point. Great point. Well, this conversation is leading directly into the next area that we wanted to sort of talk with you about is basically challenges and opening the floor to hear from you. One of the things that we feel the healthcare industry is facing, particularly as it relates to the CNA occupations and other occupations that need that hands-on clinical experience to finish their certifications, is that our current state of emergency does not allow that hands-on participation to occur. It does allow for simulations to occur for the certifications to be awarded, but students who are going through that process are not getting they're not touching human beings, they're touching sims. And we're concerned, I'll be honest, I'm concerned that when the restrictions are lifted, we're going to have a backlog of need, and we'll need to get individuals through quality training very quickly. And so maybe my fear or concern is unsubstantiated, but I'd really like to hear from industry in terms of any occupational backlog needs you feel you might have, or that this COVID environment might be creating, in case they're not on our radar. And then additionally, just in general, other healthcare related concerns that you have that you feel we as a convening body might be able to address or bring to you in subsequent conversations. So we'll open the floor. Okay, I see a comment. Right now, we don't have a ratio requirement for virtual services. However, we go back in person, we're required to implement that ratio. Again, there'll be a big hole. Yeah, okay. I get it. That's what I'm concerned about. Yeah. Very concerned about that regionally, particularly for not as much for the hospitals, but particularly for the long-term care communities, disability services communities. I believe, and I could be wrong, that the hospitals are in a better shape there. And okay, Ruthie, it doesn't seem like there's any other questions or concerns related to that. Yeah, disability community. Mm-hmm.
Anyone else?
Mm-hmm.
This is our opportunity for dialogue and hopefully directing the efforts of workforce development.
Yes, if I could just expand on that comment. Our goal by convening with you is to bring forward solutions, information, recommendations based on what you as an industry say your needs, challenges are, or information you'd like to have. So certainly either during these meetings or between these meetings when things come up that you would like to have brought to the forefront, please share those with us because your time is valuable. We certainly don't want to waste it or minimize it by being talking heads here. We want to give you quality information based on your needs.
Can anyone hear me?
Yes.
Oh, thank goodness. This is Clarissa Mitchell. I've been working feverishly trying to get my audio to kick in. So wonderful. I would like to make a statement regarding the entire platform here. First and foremost, we absolutely appreciate your assistance and everything that you're doing, Kelly, for your research, so on and so forth. I feel that one of our biggest challenges with retaining, first of all, we have to get the staff. You saw the challenges that we have based on what those minimum requirements actually are, their age, whether they can drive, so on and so forth. But then once we actually can get them in the door, if they have a clean background, it's a matter of them being able to come in, sit down for a 2-week, maybe 2.5-week block of time where we can actually train them. The bigger issue I know that our company has is that other people have other responsibilities during the core times of training. So if you have a person who's coming in and they even just are looking at it as a second job, they have obligations during the core time, Mondays through Friday, where they're on another job, they're in school or whatever the case may be, so they cannot make the trainings. Sometimes they'll get halfway through and then they just leave because they can no longer afford to stay and take the trainings. Even when we've toggled our trainings to accommodate weekends and evenings, which is very challenging for us to do, we still have the same issues. One of the things that COVID has absolutely helped us to learn and understand is going to an online platform. However, that only works for some of the training. Some of the trainings still that are required of us need to be face-to-face trainings. So we then fall into a similar pattern as to whether or not a staff person who's or potential staff person can take off for the time to take the classes when they are also balancing other issues. And now to add to the plate, they're also teachers in the home to their children. So as much as we know what we need, we're not sure how to ask, or even if you can assist us with the challenges that we're having with our training. I sent out the list to Ruthie, and Ruthie, as you can see, at a minimum, 72 hours is required. That's not to include any specialized training that a person may need if they have aging issues or if they have seizures activity, if they have behavior issues, all of these other trainings. And now to top it off, the COVID trainings. So people are being trained to death, and for the minimum wages of what they're having to deal with. When you're looking at the disability industry and compare it to the healthcare industry, we're talking about nurses who are getting $50 an hour to put themselves in harm's way and working with a population who possibly could have greater risk of COVID or working directly with people with COVID. We're asking the same of people who are getting $13 an hour or less. And there again lies the challenge. And I don't know how to fix it. I wished I had better answers, but hopefully this group, and we can all pull our brains together, can at least figure out an equal workaround. That's my comment.
Wow, Clarissa. I mean, really, I mean, what you've said is, I think it really summarizes the weighted concern that we've been hearing in such an eloquent way. And I think what we as the workforce community want to help you do is propose as much of that training occur outside of the actual employment. I don't know if the COMAR regs require that you, as the DDA provider, deliver that training. If it does, then we have to take a different approach. But if people can come to you with that training, and of course, there's always going to be continuous, ongoing hands-on training that happens on the job. But if they can come to you with that baseline training, they've made that investment, and they see the investment that they're making as one along an educational pathway towards not just that job, but other jobs in the healthcare industry, because so much of what they will be learning could take them towards a certification, other types of certifications in healthcare. I believe that is one way that we can help to address the shortages, providing these work-based opportunities as well.
Right. And absolutely, Ellen, we can actually have a staff on board that have had the training someplace else, as long as that training, is what is required for DDA. So yes, if the college can train the masses of people and then they send them out to organizations such as Epic, Springdale, Melwood, so on and so forth, then absolutely we can use them. That would be of a great assistance in doing so.
Ellen, this is Donna from Springdale, and hi, Clarissa. We ditto all of Carissa's summarization of kind of the state we're in at this point. And Ellen, you actually kind of took the words right out of my mouth, because I think we are looking at an industry literally crisis right at the moment that we need to work towards providing relief to, but we're also looking at a future industry that needs to take a change. And that change is valuing the jobs of direct support professionals. And unfortunately, a lot of times wages decide whether or not that job is valued. And we all know, working in the human service field, that is so far from the truth. But we also know that our employees have to earn a living wage as well. And so ideally, I had had this discussion with someone probably a year and a half ago, how cool it would be, just like CNAs get their CNA and they value that certification they have, and they can go anywhere with that certification and get a job that requires that. As the DDA industry, we would love to know that the college has adopted this certification for the DDA community industry, and that people during the time that fits their schedule, whether they have kids or 2 or 3 other jobs, they can work on getting this certification that meets their timelines. and then come to us as an agency with that certification. And I know I can speak for Springdale, and Clarissa, you would probably say the same. The investment that it cost us to train people to only have them stay for 30 to 60 days is horrific. So I know I could raise my starting wage for those people if they're coming with that certification. It would be a tremendous relief to know they're coming with that. There are other trainings they would receive at our individual agencies that are specific to the people they're working with and the needs of those people. But to have all the generic training completed would just be a godsend. And so all the providers in the county were all providing the same training, and a lot of times to the same people because they work for multiple agencies. So to have you as the hub and to have this now as a new certification that the college offers, which we have spoke about before with the college. And I know, Clarissa, you might be able to speak on this, but I remember back in the day when the PG Community College did the same thing, but it was the agencies that were paying to put the staff through it, and it was way too expensive. But if employees can get this certification before they even come to work for an employer, maybe there are grants and avenues that would help pay for their tuition, which would be amazing.
Mm-hmm.
Yeah, actually, Donna, I do recall when the Prince George's Community College came together and they got approval and credited to actually have the DDA trainings go through them. But again, it was a burden on the agencies because we had to supply the trainers. Our staff had to go in and actually do the training. And if you did not have a staff person to come in and do the training, you are still obligated as an employee to pay per head of people that you sent. And there was also a cap. So your agency may only be able to send in 5 people in a month's time. And that's how much money you could basically afford. One of the other things that Prince George's County College actually had started, but it did not become effective and grow legs, is they started a similar apprenticeship. And they took a specific group of people, I believe they were 10 or what have you. But in a nutshell, they provided a training model for all of the DDA training. And they also did soft skills training and made them this one perfect, staff person. And every one of the agencies was on board until they dropped the bomb and says, you cannot pay them anything less than $14 an hour. Mm. And this is when we were struggling to pay $10 an hour. And we were like, oh, whoa. So if we could even try and mimic a model like that, but where it would not have such a hardship tied to it, where we would have to pay them great wages beyond what we could actually afford.
Well, that sounds like there was a specific grant that had a wage requirement tied to it that they were leveraging. That absolutely sounds like that. I'm familiar with some of those grants from DOL. But I think what you're hearing from the workforce community at large here, the K through 12 system, the college, and the workforce board, is that, one, we have competent individuals that we are training. That two, many of these individuals are looking for work-based experiences. And three, and most importantly, these individuals are already committed to a career in healthcare because they are taking steps towards that. These types of positions can be an on-ramp for someone who's not either certified at the next level, which, for me, I think it would be a CNA, LPN. They're not certified as that or any type of technician, but they want to get their feet wet and learn about the environment. This is a great on-ramp program for those individuals. And I think a program that's built well will structure the competencies that those individuals need to step into that next level of certification on a pathway that supports them. So all of their education counts. And we would work with our K through 12 partners. We will work with our workforce board for those individuals who might be eligible to get some type of support through the federal WIOA program to help offset the tuition that they would have to pay. I think there's a compelling enough need, both short and long term, to develop a program. But as Kelly mentioned earlier, we can't put a program together until she gets that additional industry input that she needs on the curriculum. And at the same time, we need to be talking with our K through 12 system about how we align this and make it work, because we don't want to operate as a silo. This is a community problem, so we have to respond to it as a community.
I would also like to interject, if I may, that it's very important that young people or any job seeker or any career changer understand what the career pathways are in an industry. So we need to do a better job of helping young people and job seekers and career changers understand the steps that they can take to progress within an industry.
Absolutely.
Yeah, I absolutely agree with that, Ruthie, because one of the strategies that I know we've used at Epic is to try and go out to the high schools and to let them know that these jobs exist. This is a possible career path for them. Because oftentimes they don't know that disabilities field is even out here. I myself got recruited directly out of college. And even in high school, I wasn't fully aware that the industry existed until I stumbled upon the need for a summer job. So I think educating folk and letting them know that this is an industry that can be used as a career path.
Okay, so
Hi,
I think
this is Mary Jane Soff again from the Tech Center and from Tech Jobs Rule. I think you're absolutely correct that young people do not get enough guidance. We have many students that graduate from the Tech Center that don't know where to go from that point on. So I do think some outreach to high school juniors and seniors, job fairs, those kinds of things are really necessary. I was at the Tech Center for 20 some years, and it just seemed as though a lot of these students graduated from the Tech Center and from high school and didn't really know what to do at that point. We have a medical assisting program at the Tech Center. We have the Academy of Health Professions. Many of those students are seeking jobs as GNAs or CNAs. And our program is linked with the hospital. But I think there's still some more work that needs to be done to pick up some of these students who are not going on to higher education to get their RN. They're looking at a GNA position or a CNA position. And I think we need to grab those students and really guide them. It seems as though the ones that are headed for an RN, they seem to get a lot of guidance, but those GNA, CNA students, I feel really could use someone to grab them and basically tell them what's next. Even if we can't get them a hold of them until after they graduate, they're coming out of the Tech Center with CNA, GNA certifications already. So I'm glad to hear that. I think, Ellen, you had said you're going to be speaking with Mike Boyle, who is the CTE supervisor, because I think there is some, some work to be done with the Tech Center where we could help prepare students for the next step.
So I'm just going to.
This is Donna again. I think along with what Kelly just said and Mary Jane, it ties really together, because I think the students truly they can't visually see a career path in community programs such as the DDA programs, whereas you might visualize a career path in a hospital or other places of institutional type care like that. But Kelly is right. We really haven't done a good job as an industry in mapping out a career path for people in community type programs. If you're hired to work in someone's home to care for them, what is the next thing for you? you know, and one of the things that the state is working on right now is looking at levels of direct support staff 1, 2, and 3, where it means educational and professional development and advancement within that job, meaning you don't have to take a supervisory job or a director job to feel that promotion and that growth. You can do it as a DSP. So that's like a second part to what I'm saying. But the first part is I really don't think students understand at all what community program pathways are. So I really appreciate those two comments.
And I wanted to add too, to Mary Jane's point, I think we also need to advance more of the apprenticeship model, because the apprenticeship model is truly geared towards those who are not needing or seeking a college education, but will find certifications and training through that apprenticeship that lead to very well-paying, satisfying careers, and they're paid to learn while they work. So that's such an important model for young people coming out of high school to understand, and we need to do a better job of getting that word out as well. I'm glad to hear that you guys are working with that apprenticeship program, the Maryland Apprenticeship Program.
The apprenticeship program that I'm working with is really geared towards me finding spots for students that are looking at defense contracting kinds of positions. Our welding kids, our engineering, CAD, production engineering, electrical wiring, those type of classes are the ones that I'm really working with. But Bonnie Kelly, who spoke just a bit ago, and I'm not sure if she's still on here, she is the person to set up those type of apprenticeship programs for medical kinds of things at the tech center, and we work very closely together. So I'll make sure that I get with her, and maybe we can brainstorm some ways to pull Mike Boyle in and look at these classes and look at least having guest speakers, people coming in to talk about those types of jobs, you know, initially, because like I said, that's a missing link right now. So I will talk to Bonnie Kelly and Mike Boyle. I'm sure you're going to have some conversations with him, but I think there's some things, definitely some work to be done to grab some of those students. It is frustrating to me when I see these kids graduate from the tech center and then I see them working in retail or in, you know, at Wawa, and I ask them what happened to the medical or what happened to the welding or whatever, you know, that you were taught at the tech center. And basically they say, you know, to me, what I get from them is I didn't know where to go next.
Oh,
so, you know, that there is some work to be done. The apprenticeship program is a great way to get kids out. I have some students out right now, even with COVID, that are working in some defense contracting placements that are getting a great experience, and they know exactly what they're going to do once they graduate from high school.
This is Ellen. I just wanted to comment. I think I see, you know, several real opportunities for us to really explore the next time we meet. I think one of them, Ruthie, USDOL has done over the years a tremendous job at creating various documents that map career pathways, and particularly along the healthcare spectrum. I'd be very interested in knowing if they've done one on community health. I'm sure that there's something there we could use as a starting point for creating a visual or some type of infographic for this community to be able to use. Kelly is saying there is. So we need to get that to this group, share it, and see how we want to tweak it for our area to help communicate that. I think that's a great opportunity for us. I also think that there's a need to talk about how we connect some of these graduating students from the CTE programs with the regional workforce system, because one of the very foundational and important roles that that system plays is job placement assistance. And if students are graduating and don't know where to go next to seek employment in the fields that they've received training in, that is a place for them to go. They may not have known about it, they may not have seen themselves there, or maybe they don't fully understand what's there to help support them, but there is a whole system with professionals there that can help guide them along the job exploration pathway. So maybe there's some opportunities to explore how to make that happen systemically, because you all know this, the longer they stay out of the field that they study, the less relevant those studies are.
Yes, and to Ellen's point, the programs that are supported at the Tri-County Council for Southern Maryland provide that kind of assistance to any job seeker. And we also have a whole different division that focuses strictly on young people, ages 16 to 24. To provide them with the supports they need to move forward with their career aspirations. So connecting young people to the workforce system could be so much more helpful than having them flounder on their own when they come out. So we need to find ways to do that and to let them know that, you know, to Mary Jane's point, they come out saying, I didn't know what to do next. Well, here's what you do next.
Right. So I think there's some great opportunity there to formalize something. Yeah. Anything else as we're wrapping up this quarterly table?
I think that, this is Mary Jane again, I think that we provide them with information. This is, you know, I think that the teachers at the tech center provide them with information. And for a lack of a better term, their hands still need to be held a little bit tighter, because they don't act on maybe that paperwork that they've been given or something like that. I just know I've been working in this apprenticeship placement job for 2 years now, and I just have realized that I need to be much more active and handhold much more than I ever thought I was going to need to do for some of these students who some don't have the parental support to help guide them and push them a little and make sure that they're following up with things. I just was not expecting, from my experience, to have to grab hold of them so tight. And so I think that's something, as we go forward and look at how we give high school seniors information, that we should keep in mind. Just handing them a pamphlet or some type of you know, form that says call this number or whatever, they're not, many of them, good at following through with that. Whether we should be saying, well, they should be ready for that or not, the reality is they're not. And so, you know, I don't know that I'll be in some of these planning meetings, but that's just my advice, is that we have to grab hold of them a whole lot tighter than we are, and really guide them to what's next for them more than we are right now.
Yes, and that's given me an idea, and I just made a note that I'll be seeking some grant funds to perhaps do a video that could be shared with the high school juniors and seniors that illustrates a success story from somebody just like them who took the appropriate steps following graduation. So I've got that on my to-do list. Thanks, Mary Jane.
Yeah,
Sure.
and I think there's definitely an opportunity to brainstorm that as a topic for how we do a better job as a community in engaging the investment. These young people are an investment in our community, and how do we engage that investment in a better way? None of us benefit for them not connecting to a workforce that needs them so desperately. So we have to figure that out. And so we'll solve world hunger and create world peace the next time we meet.
I think we have about 5 minutes left. And if you don't mind, I would love to share some information with you about a very exciting opportunity that we at the Tri-County Council are launching to the community in Southern Maryland within the next week or so, hopefully, fingers crossed. We have a brief presentation, Sandy, if you could pull that up and share it. We want to talk about Skill Up Southern Maryland. And what this is an online, available 24/7. Go to the next slide, please. Oh, wait a minute. Let's watch a little video first. Then I'll tell you.
Communities across the country are facing unprecedented challenges due to the coronavirus. Millions of Americans are losing jobs as businesses struggle to generate revenue. The majority still working are doing so from home. As history has shown with previous crises, we will pull through this together. Our career centers are here to help you prepare now for the eventual economic turnaround. With a large portion of our community expected to be home for the next several months, we are extending access to the Skill Up program to our unemployed residents and local employers. Skill Up offers the opportunity to update your existing job skills, learn new skills, and even pursue an industry-recognized certification as you prepare to head back to work. The program provides access to over 5,000 courses, training for over 100 certifications.
Ruthie, we can't see it.
Anywhere with internet access 24/7. If you're interested,
I can see it. Can anyone else?
I can see it.
Sybil said she can see it. Someone else texted they could not see it. I can't see it. So
I can see it.
Okay.
I can see it.
Well, keep it moving. It's okay if I don't see it.
Okay, that was, wait a second here. That was just a little introductory video to what we'll be launching shortly called Skill Up Southern Maryland. It is free to any resident and any business in Southern Maryland. All you have to do is go to the link, and I'm going to send this presentation out along with other materials following the meeting for those of you who couldn't see it. It's southernmaryland.skillupamerica.org. It's a self-paced online portal. It's available 24 hours a day, 7 days a week to anyone with access to the internet. What you do is you can do many things, but you can explore careers, you can select a desired industry path and work on getting towards certifications in that industry, or select courses to upgrade your skills, either soft skills or very, very technical skills. Sandy, if you want to go forward. That's our landing page, and as you can see, there is a link for job seekers, a link for employers. We'll talk in subsequent sessions, and I'll get information out about what employers can do with this. But basically for job seekers, go ahead, Sandy. They can update their skills, they can search job postings, and they can connect with local career centers. Let's go ahead and advance. The good stuff's coming. Okay, so what you do is you land somewhere in here and you pick a career or an industry that you're interested in. You can explore occupations in that industry. You can hone in on where you want to go relative to your skill enhancements to become a participant in that industry. And then, go ahead, Sandy. You take a series of assessments, self-assessments, 5 to 10 minutes in your chosen industry pathway, choosing a desired occupation. And based on these self-assessments, you're going to get that pie chart that you can see to the right that shows green areas if you have all those skills, blue areas if you just meet the skill requirement, and red areas where you have a skills gap. Based on that, courses will be automatically recommended to close those skill gaps. And the progress chart will update as the courses are taken and passed. So it gives a wonderful opportunity, kind of, Ellen and I call this an on-ramp to the workforce system, because you can start with very, very basic skills, or again, for job seekers or career changers, this is an excellent tool to understand what skills are needed and to actually get those skills to advance in that industry. So we're hoping that people, while they are perhaps laid off or have some additional time at home and see some areas where they can improve their skill sets, will get on this platform and use it to their best advantage. And we will be launching a great deal of outreach, some press releases, other information to try and make sure that we've reached every citizen of Southern Maryland that could benefit from this platform. Is that it, Sandy? Oh, here you go. We wanted to add here that for the healthcare industry, and this shows just a few of the things that the occupations that you can pursue. You choose one of those and you take the assessments, and it will guide you on your path towards upgrading your skills to meet the needs of that occupation. So you can explore many, many industry pathways through this. And the last slide says what we're trying to help you with: workforce development, working to fill your pipeline with skilled applicants. So be on the lookout for some announcements coming up very shortly within January about this, the availability of this platform. And we're at 9:31, but I am very happy to take any questions if you want to spend some more time.
Donna, just out of curiosity, because I couldn't read the list really, really fast, but I was thinking immediately, okay, how would our industry be introduced as a possible occupation that somebody would go through that process for? And I didn't see, because we're not really healthcare. So this is like a great starting point where Kelly, and I think it was Mary Jane maybe talked earlier about, educating students on the career path in our type industry. And so maybe after this meeting, I would just like to look at it a little bit closer to see if our industry is truly reflective in that drop down.
Yes, and we have lots of educating to do ourselves relative to this platform because it is so robust. Sandy just pulled out a couple of things that kind of pointed to healthcare, but Sandy, could you put in the chat box the link to Skill Up Southern Maryland? And anyone and everyone, we haven't launched it in terms of a big flashy opening yet, but it's ready. So Sandy,
but Ruthie, I think in your in the defense of the makeup of that tool, our industry as a whole has never truly been marketed well at all. People just don't know where we fit. And up until a couple years ago, we were always thought of as healthcare, because we still promote ourselves kind of as healthcare, as direct support workers, but our industry has also moved towards a business model where we're not just looking for employees that have that big heart and can, change and feed people. We're looking for employees that are now educated and can promote employment in the community and talk to employers, and looking at how to match participants with their community, making friends, building relationships, all those things. So, here nor there, our industry has never really had a clear defining marketing title to move forward with in high schools or colleges. So I think this is a great opportunity to see where we can land a mark even on that tool that you're using.
Agreed. Sandy just put the link to it in there. Please feel free to jump on it. This is all free. We have this grant for a year, so I want everybody that can possibly take advantage of it to use it. And not just job seekers, but those of us looking to better define our industries. And I'd like to have a name for your industry. Is it community health? Anyone? Okay, well, I will do some digging into the Skill Up Southern Maryland platform
Sorry, I
Thanks.
was on mute. So we're community supports, community services. We don't have the term health in anything that we use.
Okay.
And so like even our services have changed to meaningful day services, community employment services. But I could get together with Clarissa, and I think Kat is on this call too, and maybe a couple other specific Dee. I mean, there are terms that are being used now, of course, for community versus building type settings. So all of our supports, the intention is that they're all provided directly in the community, unless, of course, you're providing someone in their home, supports in their home.
Okay, very good. I see some willing participants in the chat box. So if there's anything that we can do to help you convene your group or to add to this discussion, we are more than willing, ready, and able to do so. And please jump on Skill Up Southern Maryland, check it out. Anything closing remarks, Ellen?
Nothing other than thank you to everyone for this really great conversation. You've given us some homework that we'll prepare for the next time we meet.
Thank you all. Happy Wednesday. Happy New Year.
Thank you.
And to all of you. Thank you, Ellen. Thank you, Ruthie.
Thank you.